Hello, everyone. My name is Nineveh Reyes, and I'm a graduate student here at NC State. Today, I will be presenting my poster on female sex hormones and disease development when it comes to neurodegenerative diseases and neurological disorders. We'll be discussing three different studies that contribute to important knowledge on this topic. And to start off, we're going to lay out a better understanding of the topic by providing these definitions right here. The hypothesis drawn here is that in some diseases, female sex hormones can serve as a neuroprotective factor, while in other diseases, they can increase the likelihood of disease development. As mentioned previously, I reviewed three papers that examine the role of female sex hormones in disease development. The first one being done by DeLange et al., where they were interested in how estrogen affects women's risk on development of Alzheimer's disease. This first study was composed of two parts, the first one being a questionnaire regarding reproductive history, and the second part where the study involved a measuring of cortical and subcortical thickness and volume. Moving on to the second study performed by Zhu et al., they were interested in how the lack of estrogen affected the development of depression and anxiety-like behaviors. They performed an experimental study where one group of mice received bilateral ovarectomies and the other did not, and that group served as the control group. After recovery, a group of the ovarectomized mice were administered with different types of estrogen at different doses, and then at the end, these mice were then put through behavioral tests. The third study was done by De Jong et al., and they were interested in studying how estrogen affects the development of ALS. And this study was similar to the one done by DeLange et al., in that the women were provided with questionnaires regarding their reproductive history. Moving on to the results of these three studies, Table 1 is associated with DeLange et al., and it's telling us the associations between the estimate of sex hormone exposure and apparent brain aging. So the variables that were studied are on the right-hand side, and they all measured estrogen exposure. I want to point out that there are two p-values. The rightmost p-value is a corrected value. And here we also see that the p-value of some of these variables are significant at 0.05 level. Here's the study done by Zhu et al. Figure 1 is telling us the behavioral effects of estrogen exposure on overectomized versus non-overectomized mice. In all of these graphs, the x-axis lists all the 8 different mice groups. So in graph 1, we see the results from the sucrose preference test. And then on the y-axis, we're looking at the sucrose preference in percentage from 0 to 80. Graph B is telling us about the tail suspension test, and on the y-axis, we're looking at the immobility time in seconds from 0 to 150. Graphs C, D, and E relate to the elevated zero maze results, and on C, the y-axis is composed of time in open arms in seconds from 0 to 150. In D, the y-axis is composed of number of entries into open arms from 0 to 30, and in E, we're looking at the distance in center from 0 to 3. F and G are telling us about the open field test. And on F, we're looking at the y-axis, the number of crossing squares from 0 to 150. And G is telling us the time in the center in seconds from 10 to 50. I want to point out that we have values that are significant at the 0.05 level and 0.01 level compared to the control group defined by the asterisks. And then we also have the hashtags that represent significant values at the 0.05 level and the 0.01 level compared to the overectomized mice. So moving on to De Jong et al., here we have figure 2, which is telling us the effect of years of estrogen exposure on survival of ALS. On the y-axis, we're looking at cumulative survival from 0 to 1, and then time in years on the x-axis from 0 to 5. The lines represent the years of unopposed estrogen exposure, where the dotted line represents 12 years or less of exposure, the solid line represents 12 to 16 years of exposure, and the dashed line represents 16 years or more of exposure to estrogen. These results were interpreted to mean, in the case of DeLange et al., we can look back at the table. We see significant values for ICE, HRT status, and age at HRT initiation, indicating that these variations in estrogen exposure could play a role in brain aging. And overall, DeLange et al. concluded that higher estrogen exposure leads to more apparent brain aging, which may explain why women are at a higher risk of developing Alzheimer's disease. For Zhu et al., we can go back to the graphs and see the first bar compared to the second bar in all of these graphs. We see a decrease in positive behaviors seen in graph A and C through G, and then an increase in negative behaviors such as immobility time in graph B. Moving on to De Jong et al., looking back at the figure, we see that when exposed to 16 or more years of estrogen, over here, there's an increase in cumulative survival rate compared to less exposure. And De Jong et al. Interpreted this to ultimately mean that estrogen may serve as a neuroprotective factor in motor neurons. So limitations, one of the limitations that I saw when reviewing these three studies, I saw in two of the three studies, those performed by De Jong et al. And DeLange et al., is that there may be recall bias due to the use of self-report questionnaires. Recalling age of menarche and accurate exposures to hormone replacement therapy and oral contraceptives can be difficult for some and therefore may skew the results. As far as significance, identifying the effect of sex hormones on disease development may aid in finding treatments for both neurodegenerative diseases and mental illnesses, using HRT, therefore improving symptoms in said diseases. As far as future research, I suggest studying a more diverse population, maybe performing a questionnaire study on populations from different continents through a meta-analysis. The significance of the study would be more effective treatment development on a global scale. And lastly, here are my references. Since this is a recording, feel free to leave any questions in the comment sections, and thank you for your time.